We went for Paul from 10 states in the U.S. having native wildfires burning, say in the mid 2010s. It was just 10 states. It was a Western problem. So now over 30 states in the union have wildfires that can cause an extreme smoke event across the country in a given year. That is extraordinary pace of change.
Welcome to Independent Americans. Welcome to episode 579er. I'm, of course, your host, Paul Rieckhoff, and I am coming to you from New York City, USA, and the weather here is pretty nice, very nice, like high 70s, low 80s, and sunny. I am back at it after another demanding dad weekend. I went to Mountain Creek, which is formerly Action Park, which means I went to a water park that used to be called Class Action Park. If you've seen the documentary or you grew up in the tri-state area, you know what I'm talking about. Needless to say, I am bruised and I am battered, and I'm going to need to talk to our upcoming guest. But before we get to that, another service member has died in the Middle East, this time in Iraq. That brings the total to 3 over the weekend, including the 2 that were killed in Jordan. I'm going to continue to stay on top of this. Our guest today will also be a good person to touch on that. But the human cost of this war in Iran continues to go up. No formal response yet from Trump. I will continue to remind you to support Tragedy Assistance Program for Survivors, linked in my show notes always, and on the website. They are always there to provide support for any of our fallen and their families, not just now, but in the decades to come. This is dropping on Tuesday, so a reminder that it's primary day in Arizona, which is semi-open, which means independents can't really have a true and equal vote. We are allowed to vote in partisan primaries, which is not what right looks like. Of special note, former Giants kicker Jay Feely, NFL player, is the front runner in the Republican primary for a key congressional seat there. This is a time of tumult. It's a time of stress. It's a time of sun and smoke, and we need a doctor. Every 6 months or so, at least, we need to check in with our doctor, and we're going to do that today on everything from testosterone at the Pentagon to smoke to diarrhea lettuce and much more. He is a returning champion. He's worked also at the Boston VA and Puget Sound VA. He's a major in the Air Force Reserve, a Harvard-trained pulmonologist and medical analyst for MS Now. He does a lot of really important leadership work across the medical facility. He helps break it down. He's the host of Midas Health. He's a pulmonologist, an ICU doc, and a U.S. Air Force Medical Reserves Corps officer, and on the board at the American Lung Association, which is important given everything that's going on affecting our lungs. Back on the show, the great and powerful Dr. Vin Gupta. Welcome back, sir.
Paul, I love being here with you. Thank you so much for having me.
I need a doctor, man. Our country needs a doctor. We all need a doctor. So I did a really stupid thing. I went to a water park at 51 years old and jumped off really high things into water. Probably not the best idea, right? But I got so many things, like my shoulders kind of jacked up. I got really good burn, like I don't know what you call it, like water slide burn, where I tried to use my elbows to slow myself down in the cannonball. And I feel a bit banged up. So I feel like I'm reflective of America this summer. So I need you, man. We always need you. But let me start with, where are you and how are you, Doc? It's been too long. Where are you and how are you?
Yeah, well, I'm luckily back home for a few days. I feel like between my roles in medicine, I often don't get to sleep in my own bed, whether it's in the ICU or traveling for policy work or for the reserve. So I'm so delighted just to be home with my kids, my wife, and that's in Seattle, just a little north of Seattle, Washington. So, and not far from JBLM, where I spent the last 12 years of my life. So it's great to be home.
Seattle was also like the epicenter of USA soccer this World Cup. What was it like to be in Seattle with the big USA game there? Obviously, we didn't get the result we wanted, but they chose Seattle because it's such a great soccer town. But what was the energy like in the city during that?
Oh, it's incredible. I know the organizing committee, because I worked with a few of them during COVID to help restart some of our sports stadiums. And I got to say, it was Peter Tomazawa, former CEO of the Seattle Sounders, one of the best teams in all of MLS. This is an amazing, it's not just an amazing soccer city, Paul. I mean, I'll say this is my adopted hometown. Grew up a lot of my life in New York City, born in, or raised in Ohio, born in New York, spent a lot of my professional life in New York, adopted hometown of Seattle. Uh, it is an amazing sports city, and it's a travesty that it doesn't have an NBA team, for example. And I hope conversations on expansion uh, are actually going to happen, because this city, as you can tell, and hopefully all of America could tell, this can sustain a lot of major sporting events, world class sporting events, and it deserves its own NBA team back. And I hope people saw that, and especially visitors who came here and saw Seattle in what I think is one of the best cities in the country during summertime. It is. I don't know if you spent much time here during the summertime, but it is unbelievable. It's what you just described New York is right now, Paul. 70s, sunny, not a cloud in the sky. Again, just look at a very dynamic city, very capable of hosting major sporting events and deserving of an NBA team.
I love Seattle. Been there a lot. I remember when I first went there on my book tour. I think they said they read more books per capita than almost any city in America. I always tell people you got to go see the Experience Music Project
Oh yeah,
museum, which I think is one of the best music museums in the world. But there's so much to love about Seattle, and I think you're so right about what I hope will be called the Sonics again. I don't know what they'll call them,
that's
but I often say that as independents, we're kind of like Seattle Supersonics fans. Like, we're here, we're really passionate, but we don't have a team or an all-star to root for. And I think that that's changing for the independent movement, but also for Seattle. So you got my vote. Maybe you can run for governor of Washington and bring the Sonics back and keep everybody healthy. What do you think?
uh, that's definitely one option. But we need support from across the country, and we're seeing it now. There's a whole, I say, business leaders now are finally lining up. There's going to be, I think, a few bids here that are compelling, and so hopefully the league saw what we could do for the World Cup, and that's going to play itself forward.
Right on. All right, there's a lot I want to get to beyond my water slide rash here, which just hurts like a motherfucker. I forgot how much like a road rash burn can hurt. Independent Americans, if you watch or listen to the show, you know the 2026 primaries are taking shape. You also know you can trade on the biggest political races on Kalshi. With Kalshi, you can trade on major primaries, election outcomes, and the biggest political storylines as they happen. And it's primary season, going into the biggest midterms ever. So you can trade on, for example, the Maine Senate election. Graham Plattner is out now. Troy Jackson will be up against Susan Collins. Right now, Susan Collins is trading at 36%, which means a $100 trade would pay out $265.86 if she wins that election, which is right now where I'm putting my money. The big one. Who will be the presidential nominees? On the Democratic side, Gavin Newsom trading at 19%, meaning a $100 wager will earn you out $473.45 if you want to get on the Gavin Newsom bandwagon, or AOC, Rahm Emanuel, Buttigieg, Andy Beshear, Mark Kelly. Who do you think it's going to be? They're all up there. And on the Republican side, J.D. Vance trading at 40%, meaning a $100 wager will earn you out $239.90 if J.D. Vance becomes the nominee. Donald Trump Jr. is up there. Donald Trump himself is up there. Tucker Carlson, Ivanka Trump trading at 1.3%. They're all there. And finally, a fun one. Will the U.S. confirm that aliens exist? Because this year, you never know. If you say it's before 2027, there is a 7.2% chance. If you say before 2029, that is trading at 24%, meaning you will earn on a $100 wager $388.29. So you have more money in your pocket when the aliens get here. Look, on Kalshi, you can trade against peers in a live market, meaning there's no house. As the probability changes, you can buy in and out of your positions. And for a limited time, download the Kalshi app and use the code INDEPENDENT. That's independent, like independent Americans, to get $10 when you trade 10. Kalshi, Kalshi, trade on anything. 18 and older, restrictions and eligibility requirements apply. Even contract trading involves risk and may not be suitable for all investors. Prices, values, and availability in the markets may differ from those mentioned. For more information, see kalshi.com/regulatory. Independent Americans, there is a lot going on, and you can trade on all of it on Kalshi. But beyond my personal issues, the country is facing a lot.
Sure.
And you sit at this great intersection of policy and medicine and also the military. You've got a perspective around that. So let's get to what I think is our top topic. I think it's reflective of maybe the bigger challenges we're facing culturally around health, which is I really wanted to get you on to talk about Hegseth is doing a lot of crazy shit, but he is now pushing this big T testosterone plan across the military to mandatorily test men, I think, over 30 at a time when they're denying testosterone for people who have requested it from or been prescribed it in the past. There is a legitimate testosterone issue among some members of the military that I want to ask you about, right? I guess for folks who are in special operations units and others. But this is one of those examples of Hegseth taking like a fringe thing and making it this massive cultural policy across the military, where
Sure.
it feels like he wants to make an army of RFK juniors who look like they're roided up on testosterone. And no mention of women, no mention of anything related to gender diversity. But I also think it cuts to that culture of them being this kind of knuckle dragging, muscular, don't read books, cool with flybys. But when it comes down to military culture, they are not making people take the flu vaccine, but they're screening for testosterone. I think that's kind of health policy under Hegseth in a nutshell. But what's your take on this move and where he's at in general on this?
I've had a lot of conversations with colleagues of mine that have spent 20 plus years in military medicine, either on the active side or on the reserves. I've done now 14 years on the reserves, deployed, and feel like I know what I'm talking about when it comes to health readiness and force and what that means for force readiness and deployability. There's a lot I don't know. I haven't seen. I'm not a combat vet. I'm not the one that should be holding a weapon, even though we're weapons trained. And so I want to be clear on my service to the country. It's as a military doc. So with all of that said, I have looked at various policy shifts over the last 14 years when it comes to medical readiness across different administrations. And usually all of us on the health side look at policy changes and say, well, and evaluate them through one lens and one lens alone, which is, does this help make a unit more ready to deploy? Is this useful for that purpose? When you look at it in isolation, broad screening for testosterone without any filter for symptom presentation doesn't make any sense. And this isn't just coming from me. This is coming from other military leaders on the health side. This is coming from the leading societies for endocrinology, that is basically the medical specialty that oversees our body's hormones. No one thinks that this makes any sense when it comes to deployability, readiness, and a fighting force whatsoever. This is culture war medicine, as you pointed out. But this concept that everybody needs to get screened past a certain age for testosterone, and that therefore, presumably, you would then supplement somebody with testosterone if their levels are low for whatever reason, is a sledgehammer approach. Do I think that it makes sense to screen for symptoms of, say, low testosterone, which could be any number of things, but chronic fatigue perhaps being at the very top? Sure. I think that's something that's thoughtful and reasoned. And then in certain cases, that person would benefit potentially from starting testosterone, but it's a thoughtful, reasoned consideration. If you put everybody that has low testosterone for whatever reason on a specific day, potentially on therapy, you're potentially putting that individual at risk, because you're giving people that may have a low our testosterone levels vary hour to hour, potentially day to day. So a snapshot doesn't make sense. Two, there's risks to putting somebody on testosterone that may not need it. And then three, he didn't provide a medical justification at all. There isn't some epidemic or some sort of analysis I've seen suggesting that this is necessary. There isn't anybody that's serious that's not named Pete Hegseth that is plus wanting this policy approach. And then if you also look at some of his other decisions, you referenced it, flu vaccination, making that now optional. Look what happened in Lackland, one of our most important military installations in the country. I've spent a lot of time at Lackland from a training standpoint. It is very important to just military readiness and preparedness. The units there do a lot of work, especially on the health side, for the Joint Force. And and we saw what happened. I mean, unfortunately, a unit there had flu just run rampant to the point that I think 20 to 30% of a unit, I'm blanking on which specific unit at Lackland, was rendered sick. And, if God forbid something happened, they would not be deployable. They would not meet criteria to deploy. They would have to wait until they recovered. It doesn't make any sense, Paul. So, I mean, there's obviously the culture war element here, the fact that it plays well to his supporters and the president's supporters in social media. There's an ugly side of it. Obviously, this is gender affirming care at its worst to some people. Some critics out there are terming it as such. But if you just look at it from a fact base, I mean, this is independent Americans. Presumably, we are speaking, I think, to a large majority of Americans that just believe in common sense, fact-based approaches to the economy, to our healthcare, to our military, to policies that impact all those different sectors. I think the majority of independent-minded Americans that just want common sense things being done look at what's happening and can see it for what it is, which is this is intended to appeal to a very small, loud subsegment of social media. There is no medical basis for this. And it's also, and there's no readiness argument here as well. Again, any health policy shift needs to be viewed through the lens of readiness and deployability. That's medical readiness. I mean, you've seen that. You had a distinguished career of service. How much of your time not deployed was spent focused on medical readiness? I would imagine a good bit at justifying that you were medically fit to deploy. So the two major health policies that he's done is saying this calendar year, making flu vaccines optional. We've already seen the effects of that, the negative effects of that. Now, this sort of testosterone approach or testosterone screening, they're not in any way intended to make us more medically ready, and that's his job.
Yeah, I think it's I remember when I was getting ready to deploy, we lost more people for dental problems
Yeah.
than anything else, right? And this was early days of 03, 04 when National Guard troops did not have mandatory dental care. So
Right.
you had tons of National Guard units that were showing up that hadn't seen a dentist in years, right?
Yeah.
And nothing took a guy off the line faster than a root canal or like some kind of tooth infection, right? I think I wouldn't be exaggerating when I say like the first couple weeks, 10% of the guys had dental issues that took them offline, right? And once you get a dental issue, especially forward deployed, it's usually treated pretty seriously. If you said, okay, we're going to revise our dental policy, that would make sense to me. Testosterone
Sure.
is really like him acting as the acting Secretary of Culture War and appealing to the manosphere and the Joe Rogan, RFK, MAGA health world. Now, there is in the special operations community, especially, there's been conversation about the fact that if you deploy 20 times and you don't get a lot of sleep and you start to get older, that these guys have said that there is a need for testosterone screening or treatment or support there. Can you just talk to that kernel, which seems to be, there seems to be some at least anecdotal experience there, but that's been blasted out into a policy for everybody across the million. But among these super high intensity special operations folks, is that a real medical issue?
Absolutely. I mean, I think it's, and I've heard some of that as well. I'm not as sort of versed in it, but I would say that what I understand of it is that this is a group of individuals, obviously high performing, very intense, sort of deployment cadence, and poor sleep, chronic poor sleep, insomniacs to some degree. it's not surprising to me that this is the group of individuals you would want to screen, Paul, for potential testosterone deficiency, and then to supplement them, but to be thoughtful and considerate about it. What's happening right now is these are individuals that might just get. What worries me is that this happens outside the purview of established medical practice, which I know Hegseth and a lot of these deputies want to sort of thumb their nose at. But it's important that if you're going to take supplementation, and perhaps this group needs thoughtful, considered screening of their symptoms, which I bet based on their symptom profile, as I understand it, they would rule in as positive as having consistent symptoms with testosterone deficiency. They would need 2 morning samples of for assessing for testosterone levels early in the morning, ideally on separate days, and have that be consistent with their symptom profile. And of course, we would want to supplement them because that's a quality of life issue. We would
Yeah.
want to make sure that they are given the treatment that they needed. But of course, you also want to make sure you're getting testosterone that is from a reputable, medically validated source. There's a lot of nonsense out there online that's not safe. And you also want to ideally make sure that you're getting repletion and supplementation under the supervision of a medical provider because they can
Uh-huh.
test levels, make sure that you're not over supplementing or under supplementing. If you're over supplementing, there's clear risks. If you're under supplementing, we're not treating you effectively. I mean, these things require uh, some level of supervision for a reason. It's not to be paternalistic. It's to
Yeah.
make sure that the patient is safe.
Yeah, I mean, I think I've said this before on the show. I mean, if you did a piss test across the cabinet in the White House, it would be very interesting because, RFK Jr. is all roided out, looking like, a retired WWE wrestler.
Sure.
And then you got JD Vance, who all of a sudden is getting chiseled and skinny. And I don't know if they're all on vitamin O or there's something else. And then you got Hegseth, who apparently loves testosterone, but still can't do a proper bench press or pull up. So, like, I don't know. I'm just saying that, like, if they had to do mandatory drug testing across the White House, we would have some very interesting results. I'm sure they would push back, but I do think it cuts to the larger issue of a failure to focus on real public health. And let me ask you to talk about the other issue. Trump
Yeah.
last week did a speech declaring war on our elections, while simultaneously, I don't know, a quarter of the country was covered in smoke. That would have been a perfect example of where the president, if he cared about the national health, he cared about community health, even about international relations with Canada. We could have been proactive. He could have put out public health information. He could have brought the temperature down. Instead, he decided to attack our elections. But on a split screen, smoke was engulfing, a huge percentage of the country. It's still continuing to waft back and forth. Can I just ask you to be, doctor for America here when folks are trying to figure out how to deal with what seems like a new normal now, where these smokes from Canada may come down each summer? What's your recommendation for folks and how they approach that and think about that? And where can they get good information? Because the White House doesn't seem to be the place.
Well, I mean, first of all, I would say thank you for that, TF. For a last question first, for those that are wondering, where can you get good information that's shareable, easy to understand, ways to protect you and your family from smoke? I highly recommend lung.org. Lung.org. It's a nonprofit, the American Lung Association. I'm on the board of directors of the American Lung Association. Not a dollar gets exchanged. It's all just volunteer time. And why is that important? American Lung Association is the leading advocate for ways in which we and our national policy should be framed up to protect our lungs and the lungs of, say, our children, which are uniquely vulnerable to smoke in all its various manifestations, whether it's wildfire, whether it's exhaust from a diesel school bus. Paul, this is the issue of our time. I,
Mm.
I think there's a few things here. So lung.org for actionable advice on ways to retrofit your home to stay as safe as possible. I'll delineate a few top items there in a moment. I think it's really important to recognize that if it, again, sort of keeping up with this theme of independent Americans, either we're going to get to I think about what's going to happen in 50 to 100 years when we look back on the data, God willing that there's still a human race there to look back on the data from the 2000s to 2026. But I can't imagine what those that our future generations are going to think when they look back at the debates that we're having now And the fact that it's 30 times more likely for you and I and our fellow Americans to be exposed to an extreme smoke day than it was just 5 years ago. And that you in New York City are seeing skies that we would typically only see in the western part of the United States, just say 10 years ago. 10 years ago, this was a Western problem. Now you're seeing extreme smoke days every other year. New Jersey is seeing its own wildfires. We went, Paul, from 10 states in the US having native wildfires burning, say in the mid 2010s. It was just 10 states. It was a Western problem. To now over 30 states in the union have wildfires that can cause an extreme smoke event across the country in a given year. That is extraordinary pace of change. And I know seemingly, for a small subsegment of the country and maybe one political party, we're debating the facts and we're debating this reality and we're trying to, confuse people. I wonder what people 50 to 100 years now will say when they look back on these debates and the fact that there's even any question. But for the independent-minded Americans, which again I think is 70+% of the country that have that just want common sense policies in place and want us to acknowledge truth, that is pretty stunning. I mean, I'll say here in the West Coast, we are seeing intensities and extents of fires that we never saw before. I mean, of course, wildfires were happening in the West Coast of the United States since its founding. I mean, wildfires are a part of our natural ecosystem, especially on the West Coast, but not nearly this intensity and this frequency. In terms of ways to stay safe, again, lung.org, highly recommend all of your listeners go there and pass on that information. Few key tips. We now live in a world where everybody is going to have an extreme smoke event at some point, whether it's from a wildfire in your state or across the border or across your state line, whatever it is. Invest in an air purifier for at least your bedroom, because you spend the most amount of time indoors in your bedroom. If you have an air conditioner, make sure your HVAC system is maintained at least once a year. It is critical, especially now. And if it can withstand it, if it can withstand the load, to look for a MERV 8 filter instead of whatever filter is usually given by your HVAC company. So important to keep that in mind. If you live in an independent, say, house or dwelling unit that has its own independent HVAC system, make sure it's maintained. For those that live in large apartment buildings, obviously you're reliant on the building leads and the supervisors to do that work. But for those that have your own indwelling units, keep that in mind. You also control the ability to make sure that you have adequate seals around your windows. And the reason I say this, Paul, is ever since COVID, there's been much more of a focus on indoor air quality, where we spent 90% of our lives. And it's really important for people to realize that even in an extreme smoke event, which will become much more frequent, even more so than it is now, protecting your indoor air quality is critical. So invest in an indoor air monitor just to make sure that you understand what's happening in your own dwelling, in your own ambient space. Make sure that the seals around your windows are actually seals around your windows. This is a scrappy solution, but you can even duct tape, if necessary, during this extreme smoke event, the seals around your windows to minimize seepage. But it's really important to think about indoor air quality, protect it as much as possible, invest in filters in places where you spend the most amount of time indoors. This is critical because, lastly, I'll just say, exposure to poor air quality for even a few hours, but chronically over days, if not weeks and years, leads to smaller lungs. It leads to chronic lung disease. It can worsen your underlying asthma. We know that it's an independent risk factor for coronary artery disease, just like if you had a diet filled with fries and cheeseburgers every single day, hardening your arteries. That exposure to chronic air pollution, let's say you live next to an urban transport center and you have chronically poor air, or let's say the air within your own apartment is poor. That air, those microparticles from air pollution, Paul, actually harden your arteries. And we're realizing that now as we're learning more, because this is becoming much more of a ubiquitous problem. This is posing serious risk factors to human health. So we have to start norming how do we respond to it, especially if there is not the governmental will to address this problem at its root every 48 years. Every 48 years, we have a reversal in policy. So what do we do? Now we have to react. And how do we react? We have to protect our indoor air.
Mm-hmm. Thank you for all that. I mean, we say stay vigilant on this show all the time, and I think when it comes to your health, especially in times like this, it's up to each of us as independent people and independent Americans to stay vigilant, especially for our kids and for our seniors. Last week I went for my annual 9/11 screening at Mount Sinai. Thankfully, thanks to the advocacy work of so many people that I was a part of, we passed as a droga bill that created the Sinai Health Registry, 9/11 Health Registry. I get my screening every year. I'm wearing my Ladder 20 shirt today because so many firefighters have already been lost to 9/11 related exposures. We're losing more friends every day, but it's a reminder of how an incident can create a massive public health issue. Lingering effects can last for a lifetime, impact generations. And I just want to say that like good public policy looks like there's a droga bill. Like we had to fight way too hard for it, but now 25 years after 9/11, I go up there, I get screened, I get a chest x-ray, they check my lungs, I see a social worker. I mean, it's a full comprehensive health assessment, and I'm grateful for it. But that's what good public policy looks like. And I want to encourage folks who were exposed during 9/11, if you haven't registered for the health registry, please do. The presumptions have expanded, the eligibility is expanded. You can look it up and find out more. Let's shift, if I can, below the radar to another issue that's on the forefront of everybody's mind. We always knew going to Taco Bell might give you diarrhea. But now we find out that there is lettuce that could potentially be at Taco Bell or other places that everybody's talking about diarrhea lettuce. What do we need to know here, Doc? How serious is the issue, and how can we protect ourselves? Obviously, in a different world, we'd have a public health system that was addressing it. We wouldn't have a CDC and a health screening network that was annihilated by the president. But what's most urgent for us to need to know, and how big of a problem is this for real?
Well, to the extent, I mean, Paul, it's interesting. We had reporting today suggesting that the FDA has quote unquote apologized to Taylor Farms because there was a piece of lettuce that had a false positive test for cyclospora, this parasite that's causing this outbreak that we now have all heard of. What I find interesting is that all this is done for those that are reading this and this kind of back and forth. It has just made me feel so even more sympathetic to all of us that have to try to parse out what do we make of this? Do we trust Taylor Farms? What do us as consumers of food do with this information? Are they to blame? Is this the lettuce from Taylor Farms, or is there something else going on? It is a mess. And so, what I would say to everybody is, first and foremost, understand what's happening and unknow your body. And because the information from the government right now is clouded at best. I hate to say it, but if I don't think we can trust anything that's coming out of this government right now, because the series of events this morning have just added additional complexity. I would make sure that if you're purchasing, first of all, the implicated lettuce still appears to be implicated, and nothing this morning suggests otherwise. There has been a robust contact investigation or contact tracing of what made people potentially sick at these Taco Bells in the Midwest, Paul. And supply chains here are very clear. Taco Bell and Yum Brands, actually, their sort of corporate entity, tracks this quite closely. And so it does appear that Taylor Farms, especially located in Mexico, its branch in Mexico, might be implicated as the source of this. Nothing this morning from their Taylor Farms CEO to me would argue against any of that still being true. False positive testing happens all the time because not every piece of lettuce is going to be testing positive for this parasite. So that's one. Let's hope the recall happens as it should. Number two, don't trust anything would be my advice coming from this administration. And I hate to say that because we need these entities and these institutions to be as strong as possible, because not one individual, no one state department of health, no one medical society can fill the void of the federal government on these issues. But I take everything they say with a grain of salt, which is to say, protect yourself. Know what you're putting into your body. Make sure if you're getting any produce, not just lettuce, to wash it. to wash it and to make sure you're washing it for at least 30 seconds. Know that in the case of cyclospora, it does not completely eliminate the presence of the parasite. So if you're medically higher risk, so if you're over 65, if you have an underlying medical condition, if you're immunocompromised, to cook your leafy greens for the foreseeable future until this is past us. So I think that's one important to recognize. Cooking eliminates it. If you're medically higher risk, I would still cook your leafy greens, wash your fruits, peel your fruits if you can, and take those precautions. Number two, I would also just encourage everybody, if you do develop GI upset and it's been going on for a few days and is unusual for you, and you can't keep anything down, and especially if you're in that medically higher risk category, to go and present to your medical provider, because there's antibiotics that can treat this quite easily. But early treatment is vital, and that is based and premised on early diagnosis. And so if this is you, if you're medically higher risk, if you've had a few days of GI upset and you can't keep anything down, if you're getting dehydrated, present to your medical provider quickly. Better to get early tested, early treat than to be miserable.
I mean, I didn't need more motivation not to eat Taco Bell. I mean, but now I have it. But beyond that, I somebody told me something once about Taco Bell that stuck with me. That is just a segue here. Everything at Taco Bell kind of tastes like Taco Bell. Whether you get a taco or a burrito or a gordita or whatever the new thing is, it's wrapped in a Dorito. Like it all kind of tastes like the same crunchy, cheesy thing. It's just in a different shape or a little bit of a different texture. But that's a sidebar. But nevertheless, if there was a good time to cook your food and spend more time with your family and eat less fast food, and most importantly, stay vigilant, this summer is going to be the time. We also always talk about mental health on this show. You're great about that. Something good. Oh, something sweet. So I'm going to end with something good. I'm going to go first and I'll come to you. And mine is something regarding our mental health. And it's the World Cup. I think the World Cup this is my son's World Cup trophy, his stuffy trophy that he's been running around with for weeks. I think the World Cup was really good for our mental health because I remember in my work around mental health and especially combating suicide, a great doctor once told me that the most important thing is hope and connection. And I really feel like the World Cup has brought us hope and connection as a community, as a country, as a globe. I also think that Spain winning without a star was really important. It was a lot like the Knicks in that it was a team win. It wasn't Holland. It wasn't Kane. It wasn't Mbappe. It was, a Spanish team that worked together. And then lastly, I think this was kind of good for our mental health and why I like to go to sporting events. You can scream really loud when you go, which kind of feels good. My kids love to do that. And you can still boo because yesterday Trump showed up at MetLife, here in New Jersey and New York, and he got booed. So despite all the thing that Trumps are doing, you can still boo the president in America without getting killed or arrested, at least so far. And I think that is a good thing. So overall, my something good. Congratulations to America on a great World Cup. Our team didn't do as well as we hoped. Our president is an embarrassment, but this was a great time for us to shine and show the world the best of what America is all about. And most importantly, come together in community and hope. And I think that's good for our mental health this summer and bringing some positivity, and it's something good. All right, Doc, over to you. Dr. Vin Gupta, what's your something good today?
Yeah, it's a similar thread on mental health, but I recently invested for the first time. I've been thinking about this for a while, but we've moved to a neighborhood where it's not easy to access bike trails without going down a large hill. My boys, both 9 and 4, love biking, and so we just invested in a bike rack for one of our cars. Can fit 4 bikes. We have 2 kiddo bikes, my wife and I. And there is something about going on these family bike rides where, and I know some people probably don't need a bike rack and can just like hop out of the garage and no problem, or wherever they store their bikes if they're more in the city environment. And, but, we're sort of 20 minutes outside the city. And so we have to figure out a way to get to the actual trail safely. But just doing these bike rides as a family, I can't, it's time off the device. There's no distraction. You're out there in nature. And it was something as simple as getting a rack. And I'm not sure what that could mean something different for everybody listening. For me, it was getting a bike rack for a car, but maybe it's buying a bike, or maybe it's just figuring out what family activity looks like for you and your loved ones. But I can't tell you how much just even 30 minutes of doing something physically active together, one just sets such a great tone for the week, for the day, and it gets our kids up and running, and it gets sort of out there and moving, and it just makes us feel better. And so just highly recommend whatever it might be. For me, it was the bike rack. For somebody else, it might be, getting the bike itself or getting a gym membership or whatever it could be. But joint family activities that's focused on aerobic activity, enabling that. Sometimes everybody has a notion of, oh, well, that's good for you, but how do you actually do it? And what's the barrier to do it? If you can address that, and for us, it was getting a bike rack. It's just had such great dividends for us.
I love it. That is definitely something good. My wife and I took a city bike to pick up our son at camp last week. And my wife and I were riding together. We used to do it a lot more when we were younger. I'm like, isn't this great? We're just riding bikes together, and it brings out the kid in everybody.
Sure.
Doc, I think that's such a good point to end on. And also, I saw you in New York a couple of weeks ago, a week ago maybe, and I want to say to you on air what I said to you then. You continue to be such a great role model. Our kids are around the same age. You're a great dad. You're a great patriot. You're a great voice of reason. You give people hope and inspiration, and you're just such a great role model. So I always want to celebrate that and thank you for it. I can hear your kids in the background. Thank you for taking time away from us to do that. But we really appreciate you. Everybody should follow Dr. Vin Gupta on all the social media. Look for him on the bike trails. Maybe we can get you to run for governor of Washington. But in the meantime, we appreciate you so much, Doc, and all that you do.
Paul, right back at you, my friend. Great being with you.
All right, folks, we're daily now. You know the deal. Follow, subscribe, share this content far and wide. Look for the Morning Independent. Check out our quick response pods. Thank you to our sponsors, ranging from Kalshi to Noble Mobile to Independent Voter News. We're going to continue to try to bring you this independent perspective on everything from smoke to diarrhea lettuce to water slide park rash. We're working to bring people together, add light to contrast to heat. Independent movement is the hope of the future. We are a lot like Seattle Supersonics fans, and our team's coming and our leaders are coming. And you heard it from Dr. Gupta today, country over party, light over heat, and disrupting the status quo. Our movement's growing. If you like this episode with Dr. Vin Gupta, please share it far and wide. Invite others to declare their independence. Join us on this community bike ride, and we'll stay vigilant, especially around our health, because eternal vigilance is the price of freedom. No, you're not alone in your vigilance. We're all in this together, and we're all vigilant. I'm your host, Paul Rieckhoff. Thank you for tuning in to Independent Americans. I will see you tomorrow. Happy summer. Thank you again to Dr. Vin Gupta. Get outside, get on a bike, and stay vigilant.
Archipelago, he tells me the left and right are dreams for those without a clue. And when you wake, it's time to grow. And it's not cool to believe in school, but if I can say one thing, I've seen the children of the revolution and the good trouble they can bring. He says the red and blue are dead and independent is an attitude. An island in the sea of rhetoric and archipelago, he tells me the left and right are dreams for those without a clue. And when you wait, it's time to grow.
Powered by Righteous Media.